We'd like to thank you, our valued listeners, for your interest and support over the past 18-odd months. What was initially FX Radio has grown exponentially to include not just our podcasts in FX Medicine Podcast Central on iTunes, but we'd like to also introduce the recently launched FX Medicine website. This is our reservoir of resources, research and educational content for complementary medicine. Come and be a part of the community at fxmedicine.com.au.
Hi, this is Stacy the Babymaker Roberts, and I would love for you to join me in February for our seminar going from unexplained to pregnant. This seminar will help you assist more of your patients by providing you with practical, clinically proven advice on all aspects of unexplained fertility issues, and I can't wait to share it with you. I look forward to seeing you in February, and to register for this event, please go to bioceuticals.com.au and click on the Education tab. See you there.
This is FX Medicine, and I'm Andrew Whitfield Cook. And joining me on the line all the way from America today is Dr. Lise Alschuler. Now, Lise is a naturopathic doctor with board certification in naturopathic oncology and has been practicing since 1994. She received her bachelor's degree from Brown University in medical anthropology and her doctorate of naturopathic medicine from the esteemed Bastyr University, where she also completed her residency. She maintains a naturopathic oncology practice out of naturopathic specialists based in Scottsdale, Arizona. And Lise works as an independent consultant in the area of practitioner and consumer health education. She's the executive director of the TAP Integrative, a non-profit educational resource for integrative practitioners. Dr. Alschuler is the co-author of the fantastic book, The Definitive Guide to Cancer and The Definitive Guide to Thriving After Cancer, which is specifically designed for patients. She co-created 5tothriveplan.com and co-hosts a radio show, 5 to Thrive, live on the Cancer Support Network about living more healthfully in the face of cancer. She is currently president of the Oncology Association of Naturopathic Physicians, and you can learn more about that at drlise.net. The American Association of Naturopathic Physicians recognised Dr. Alschuler in 2014 as Physician of the Year, and Lise also received an honorary degree from the Canadian College of Naturopathic Medicine and the Joseph Pizzorno Founders Award from the Bastyr University in the same year. That is quite a bio, and so proud of your achievements, Lise. Welcome to the show.
Thank you very much.
And I
delighted to be talking with you.
And I should have added that I'm so proud to count you amongst my friends. I'm very honoured.
Absolutely.
So, Lise, today we're going to be talking about something that goes hand in hand with your expertise in cancer support, but it also affects many other people in the community, and that's anxiety. So I guess first, can you take our listeners through the prevalence of anxiety? Just how common is this condition?
Anxiety is actually amazingly common. So best guess, and this comes from studies, and the reason I say guess, I'll explain in a moment, but best estimate is that about 1/4 of the population experiences anxiety on a regular, recurrent basis. Mm-hmm. Women are about 2 to 3 times more likely to experience generalized anxiety than men are, so it's a bit more common in women, which may have a hormonal connection. And I say guessed because anxiety is actually a very difficult condition to assess the prevalence for, because part of being anxious is a bit of a disassociated state. So when people are anxious, one of the effects of anxiety is they become somewhat disassociated from their kind of full emotional presence, and therefore are very likely to underreport. It's also got a lot of stigma attached to it, so people are also more prone to underreport. So I would suggest that 1/4 of the population is conservative, and I would probably, just from my experience and talking with people and patients and practitioners alike, I would probably put that at more like 50%.
Yeah, I think I'd have to agree with you there. I mean, see, the whole point for me about people reporting things like depression, anxiety is who, and I'm not being macho about this, but let's say, a male, because I'm a male, so I know what I'm talking about. What male is going to say, yep, absolutely, I have anxiety, as the answer to a question, hey, how you going today? It's not something that you readily want to sort of go into a negative unless you're really, in need of help.
Yeah, I think that's really true. I think that also could explain why there's fewer men that show up in these surveys. And I think that part of that is because anxiety is portrayed, I think, in some ways as a failure for us to cope with our lives, and that's kind of worn as a burden, a failure that we have. And there's really nothing that's farther from the truth. I mean, first of all, let's face it, the world is rather anxiety producing. There's so much going on, and just with the advent of the internet, we're all aware of bad news all the time, instantaneously. So there's a lot of stimulus that's coming into our brains that needs to get processed and affect our sense of safety in the world, which is really at the root of anxiety. So this is an anxiety-provoking world, and if we didn't feel some anxiety about it, I think there's something a little perhaps wrong with us. And there's also a lot of factors that have increased our susceptibility to feeling anxious that range from lifestyle factors, sleep, diet, exercise, and even certain nutrient deficiencies and some brain issues that are affected by all those things too. So it's not something people should be ashamed of experiencing. I think it's a very rational response to our planet.
Yeah, so to me it kind of smacks of post-traumatic stress disorder a little bit, in that it's not necessarily an irrational reaction; it's a rational reaction to an irrational stimulus. Would you count that?
Yeah, that's a great way to put it. I like that. I might borrow that, actually. That well said.
What about sequelae for those people that suffer from anxiety? We know that depression alone is actually a risk factor for death. What about anxiety? Is there any other conditions that anxiety leads to?
So many. So, when you sort of dive into the biochemistry of anxiety, you begin to realize that not even putting the brain aside for a moment and all of the neurotransmitter issues that occur in the brain in somebody who's chronically anxious, systemically we see elevated levels of cortisol, norepinephrine, and epinephrine. And those, if they're persistently elevated over time, will affect physiology, typically not necessarily a good way. Generally speaking, those hormones are associated with an increased basal metabolic rate, and that is going to affect cell turnover. So if we have any kind of, for example, abnormal cell, say that's maybe precancerous under the influence of stress hormones, we can accelerate the proliferation of that cell. Mm-hmm. Even benign conditions, there's been some studies where women who have high stress have been found to have high levels of norepinephrine in their ovarian tissue, and that affects their oocyte development. Number one, they are more prone to getting ovarian cysts, and number two, it affects their fertility. These hormones affect sperm production, sperm motility, so it affects fertility in men as well. That's just a few of many examples looking at this systemically. We all, I think, know the connection between stress, anxiety, and digestive disorders. And I haven't even touched the brain, because the kind of pattern of neurotransmitter secretions and the neuronal activity in excitability in the brain is quite affected when people are anxious, and that certainly changes our mood. And I think, like you were insinuating with depression, can also influence maybe even depression itself, which could ultimately lead to suicidal ideation and things like that. So, there's just no end to the path that can be traced back to anxiety.
I was very interested when you said, about those people experiencing anxiety during their cancer treatment, which is totally understandable. But even that itself has a physiological effect on, let's say, metastases, like bony metastases. Mm-hmm. The actual noradrenaline. helps the cells.
Yeah, I mean, if you think about cancer, but really any chronic illness that has any sort of significant impact on one's quality of life or length of life, anxiety is often seen in conjunction with that. And the anxiety affects the outcome of that disease. I feel so. To me, it's for clinicians, it's absolutely essential when dealing with any chronic or significant disease to inquire about anxiety in our patients and to address that with as much priority, because it's going to change the way that disease expresses itself, so it can have prognostic significance.
Yeah.
When people are anxious, they are in a bit of a disassociated state and they're less compliant with our recommendations, so it'll affect their prognosis. Assuming we're making good recommendations, they're perhaps less likely to be adherent to those.
Mm-hmm.
So it's just so important to assess every patient for anxiety and to make sure that we're providing support for people.
And I want to get into how practitioners can detect anxiety in those patients sitting in front of you, so that you can address that. But first, who is more likely to suffer from anxiety? Are there certain risk factors?
Yes. So I mentioned women are, at least in surveys, more likely to experience anxiety. Some underlying factors that have been connected with an increased risk for experiencing anxiety are many, and then include things like certain dietary deficiencies, particularly of minerals, which are cofactors for a lot of neurotransmitter synthesis, as well as fatty acids are also implicated there. People who have food intolerances, this has clearly been linked to gluten, but I would not keep the list that short. I think assessing for any kind of food intolerances is important because people who have that reaction to food are more likely to experience anxiety as a symptom.
Mm-hmm.
People who have blood sugar dysregulation, specifically episodic hypoglycemia or the so-called reactive hypoglycemia, are very prone to developing anxiety, and that should be a big flag. Women who are going through menstruation can kind of cycle in and out of anxiety, so that should be inquired about. And if that is in fact the case, that probably is linked back to some sort of hormonal imbalance. People who use recreational drugs frequently are often self-medicating anxiety. On the other hand, excessive caffeine intake can increase anxiety. I've actually had a couple of patients where sadly, because I love coffee myself, but removing coffee was the only thing that was needed to reduce and, in fact, eliminate the anxiety in a couple of people. So that's a really important thing to look at. Mm-hmm. Any kind, as you spoke about, any illness. I mean, any kind of traumatic event, diagnosis of a severe illness, loss of a loved one, moving, anything like that will increase anxiety. And I guess one thing I would say that's pretty interesting is that there's some very fascinating studies that have been done on people who have experienced traumatic childhood and so either been the victim of sexual, physical, emotional abuse. And as they're developing, that abuse has epigenetic implications and actually is associated with primed response to stressors. And these people, as adults, are much more susceptible to anxiety. I mean, significantly so. Yeah. And it's much harder for them to kind of self-redirect away from anxiety because they're actually, in a sense, fighting their own genetic expression, which was entrained from the trauma that they experienced as children. So anybody with a history of trauma should also, we should really pay a lot of attention to in terms of anxiety.
Yeah, there's two examples, if you like, that stick in my mind, and one is how people say, when I received the diagnosis, and let's take cancer. Mm-hmm. When I received that diagnosis of cancer, my mind went blank. It was just like, a shroud came over and I was stunned. I couldn't take in any more information, and that's that initial stress reaction, to the traumatic event. The other thing that sticks in my mind is those people that may have been displaced, and we think displacement from, say, war-torn areas, but some people might have to move because of factors that were out of their control, and that might add to their anxiety or cause their anxiety. So, you've really got to be on your toes, don't you, to key into and be present with the patient at that point.
Yeah, absolutely. And those are really good examples. And post-traumatic stress disorder is a variant or a sort of a category, if you will, of anxiety. And I think that those, for particularly as practitioners, paying a lot of attention to how people receive a diagnosis, how they're given a diagnosis of a serious disease can be very enlightening for us in understanding, what they're experiencing. One thing actually I forgot to mention, but is very interesting for those practitioners who are interested in looking at genetic polymorphisms.
Yeah.
There's a very high rate of anxiety in people who have a SNP in the COMT enzyme. COMT, is involved in a lot of metabolic pathways, including catecholamine breakdown. So when COMT has a SNP in it, it doesn't work as well, and norepinephrine, epinephrine don't get degraded as efficiently, and as a result, they tend to remain elevated in the brain, and that over time will contribute to anxiety. So it's kind of a two-sided coin, though, because those COMT SNP carriers, because of that hyperexcitability in their brain, are also very quick thinkers. They have very quick analytic skills because their brain is kind of working on all cylinders, but at the same time, the dark side of that is that they also tend to experience more anxiety.
Now that's interesting to me, because these would more likely be, I'm going to quote, do a word in quotation marks, the overachievers. But what about people who are underachievers? And I'm not talking as opposed to high achievers. I'm just saying sedation, if you like, or sedentary lifestyle as a factor for anxiety, not necessarily as a result of anxiety. In other words, to accomplish even seemingly menial tasks might give you a sense of achievement.
Yeah, and there is an association between sedentarism and sort of low engagement with anxiety, but it's more associated with depression.
Right.
Biochemically, anxiety and depression overlap a lot.
Yeah.
So it's not necessarily it's not a bad habit to sort of think of them together, but they do have some differences. Yeah.
And so how would somebody know if they have anxiety? I mean, let's go through the symptomatology, and we're talking about depression there, the differential diagnosis between that and depression.
Well, so really what we're seeing as general practitioners is what's categorized as generalized anxiety disorder, or GAD. And this is essentially defined as a sense of worry in the absence of a real threat. And so this is characterized by some key features. Number one, it's sort of a constant sense of worry or apprehension, sort of that sense of impending doom. It's also frequently characterized by insomnia, and people have a really hard time relaxing. So they have a very difficult time just, everything's good, I'm safe kind of feeling.
Yeah.
That's sort of definitionally what generalized anxiety disorder is. And to be technically classified as such, though, that triad of symptomatology or some degree of that needs to be present for at least 6 months. Now, sometimes overlaid on that, or as a part of that, but this is not necessarily present when people have anxiety, are panic disorders. And these are sudden attacks of fear, very acute impending doom, a feeling of impending doom. These often send people to the emergency room because they think they're having a heart attack, they get chest pain, they have shortness of breath, they're sweating. And those affect quite a number of people with anxiety disorder, although not all people with anxiety disorder have panic attacks. So just to kind of keep that in mind. And then, even a couple of other, in addition to post-traumatic stress disorder that we mentioned, which is that sort of receiving a traumatic event and then having other ordinary events trigger flashbacks to that event. Yep. That's an expression of anxiety. Two others that are also expressions of anxiety are phobias. So these are, technically defined as unjustified fears, although the people who have the phobia won't tell you that. But
my wife will not say that her fear of snakes is unjustified.
That's right. But when people have significant phobias and those phobias find their way into their daily life, that's actually an expression of anxiety. And then the other one is obsessive compulsive disorder, and these are just persistent thoughts. That's the obsession part, which which actually are causing anxiety, so that the person sort of self-relieves that anxiety through ritualistic actions, and that's the compulsion part. And that's actually more common than we might think, and that is an expression of anxiety as well. So I think any kind of triad of these, any presentation of these symptoms should direct somebody to assess for anxiety. And there's some great tools online that people can download. There's anxiety questionnaires, in fact, which one of the most common one is called the Hamilton Anxiety Scale. Mm-hmm. And there's another one called State Trait Anxiety Inventory. And these are essentially questionnaires that you can print off of the internet, and then you can just give them to your patient, and they can fill them out, and then it's a very easy scoring system. The Hamilton Anxiety Scale, which is the one that I use the most, is like a 14-question survey, and people just answer these questions, all of which have been very well validated, and then you get a score, and you can determine if somebody has mild, moderate, or severe anxiety. Mm-hmm. Those, I think, are useful, actually, because if you do that kind of semi-objective assessment of anxiety, you can come back to it and have people repeat it later to help them see their own progress, because sometimes they lose that perspective.
Okay, so you have anxiety. What do you do? What right now should somebody do if they're feeling this anxiousness within their body?
You know what? The first thing I would actually recommend for somebody is that in addition to their integrative practitioner, that they're referred to a very good therapist for some cognitive behavioral therapy. Not only is that type of counseling effective for relieving the anxiety, but at the very least it gives people tools to modify their behaviors, their perceptions, their distortions, so that they have a chance to change their reactions, so that it takes something that's maybe in the subconscious or unconscious and moves it into the conscious mind, which is a really important strategy going forward. Because even if you get somebody on the right nutrients, the right herbs, etc., there's still going to be triggers for them. And particularly if they have epigenetic situations that are from childhood and so forth. So giving these coping strategies is, I think, absolutely essential to the management of anxiety. And in addition to that, I think that, we can't stop there, and we need to really think through some specific therapy. So I'm not really I don't know if you want me to go into conventional management, but there's lots of medications that are used. The benzodiazepines, the GABA agonists are kind of the most common grouping. Mm-hmm. And, SSRIs or serotonin receptor uptake inhibitors, these are somewhat effective for people. They can be quite effective. I think that might be sort of a separate podcast to talk about if somebody's on these medications, how can we support them to, manage them, to maybe wean off of them eventually. But there is that whole approach, which for some people is appropriate and can really help. Yeah. If somebody doesn't want to go the conventional route, then I think we're into the land of integrative therapy. And boy, we have a lot to offer folks in this regard. And so much, I don't even know where to start. Where would you like to start?
Well, let's start with diet and exercise and sleep, because these are the basic things, the basic tenets of life. But we don't give them enough honor, if you like, in our 21st century living, do we?
Yeah, absolutely. So, okay, good. So let's start with exercise. So exercise definitely reduces anxiety. There's been some studies that have shown that exercise is as effective as conventional anxiolytics in some studies. So that says a lot. Exercise is clearly been demonstrated to reduce anxiety in all types of people. So menopausal women, elderly people, males, people with intellectual disabilities. I mean, any kind of group you could imagine that might have anxiety is most likely been studied to see what exercise does, and it improves their anxiety. So clearly a must-do strategy. A little clinical pearl that I'll throw in there, which is if people are getting a panic attack, and usually when people have a panic attack, they know it's about to happen, like maybe 5-10 seconds before it actually full-blown starts in. And if they can recognize that in that 5-second window and hit the floor and start doing some push-ups or some really pretty strenuous exercise, it can actually avert the panic attack in some people.
Okay.
So instead of breathing into that paper bag, just getting a little really intense exercise for a few minutes or a minute less can be a very useful strategy. It's a nice little thing to keep in mind.
Yeah.
So diet, there's actually the best studies on diet have come out of Australia and looking at the relationship between diet and mood disorders. And what seems to be the case, and this is the work of Professor Jacka and at the University of Melbourne.
Associate Professor Felice Jacka. She's done some really good work, hasn't she?
Yes, absolutely. Yeah, I'm just so happy to see her working on this topic. But, her work has found that there's a pretty good correlation between eating a healthy diet, one that we would consider healthy, so lots of whole foods, minimal refined carbohydrates, good quality proteins with lower incidence of depression and anxiety. And on the converse side, she's also found a correlation between the typical Western diet, high processed, refined foods, high fried foods, sugars, alcohol, etc., with increased depression and anxiety. Now that's interesting and important, but it doesn't really tell us about cause or effect. Because is the mood causing people to eat poorly, or is the eating poorly causing the mood disorder?
Yeah.
There was one study that I am aware of, and this is the only one that I've ever seen, and hopefully there's more that I just don't know about, but this was actually a randomized control trial. It was a trial that was only conducted for 2 weeks. So it was a very short-term trial, which is probably somewhat problematic. But they looked at 39 adults. They measured their anxiety and their mood, and then they randomized them to 3 different diets. One they called the omnivore group. So this was a group that had meat and poultry at least once a day. Then they had another group, which they called the fish group. And this was no meat, no poultry, but 3 to 4 servings of fish a week. And then the third group was vegetarian, obviously no animal products, although they did allow dairy. And then they looked at the mood scores and what happened after 2 weeks. And what they found was that the only group that had a change was in the vegetarian diet group. And in the vegetarian group, the anxiety score reduced by about half, and that was on 2 different measures. So that kind of indicates that there's something about either not eating animal foods or about eating more vegetables that changes our mood potentially. So, I think there's something there. And frankly, this is a rather uninvestigated area.
Yeah, that's really interesting.
And the only other dietary thing I'll just mention again is caffeine. There's really a very strong association with caffeine and anxiety. If people have chronic anxiety, it's well worth trying a period of elimination to see what happens with their anxiety. It's not always the case. Some people can have anxiety, they take coffee or tea away, and they still have anxiety, and they add it back, their anxiety doesn't get worse. So it's not always an aggravant, but when it is, it can be pretty amazing.
So that might be a trick, if you like, or a little tip for practitioners to do, is to potentially withdraw coffee or tea, or certainly Coca-Cola and other soft drinks and things like that, and high sugar. But if you can do these caffeine stimulants, withdraw those for say a week and see if they respond to that, and if not, well, it wasn't for them. Is that right?
Yep, that's actually really good. And one of the things that can happen in people who are not doing very well metabolizing their caffeine is they can have insomnia. And you mentioned sleep, and it's true that when people don't sleep very well, they tend to be more anxious.
Yep.
It's also, again, an association. So anxiety causes poor sleep causes anxiety. So you just got to break that cycle somewhere. And on that note, just improving sleep hygiene to make sure you're maximizing people's ability to sleep. If a sleep study hasn't been done, referring them out for a sleep study to make sure they don't have sleep apnea. If they do have sleep apnea and they're not oxygenating their brain very well when they're sleeping, then they will most definitely have mood disorders when they wake up.
Yeah. What other treatments do we use? Like you mentioned a few there, but you mentioned minerals earlier on and certain vitamins. But can we go into specific treatments that you use?
Mm-hmm. Yeah, and again, there's so many. I'm a little overwhelmed at the moment, but yeah, your categorization helps. So let's start with just minerals and vitamins. So there's some brain neurochemistry that's helpful to remind ourselves about. One being the serotonin pathway. So tryptophan is the precursor to 5-hydroxytryptophan and then to serotonin, and a lot of anxiety is characterized by serotonin deficiency. That pathway requires certain minerals, and the most important one of those minerals is magnesium.
Yeah.
So magnesium deficiency is often implicated in serotonin deficiency. So that's one of the first minerals that I will consider in somebody who has anxiety. Next on my list is vitamin B6. That's also a cofactor in going from tryptophan to 5-HTP and again to serotonin. And again, can be deficient in people, particularly those who are also under a lot of stress because they're kind of burning through their Bs. And so those would be sort of my top two, magnesium and B6. And then there's, just some other cofactors to keep in mind, iron, calcium, zinc, vitamin C, folic acid. These are also required in that pathway, so there's so many that kind of leads us to just maybe trying a multivitamin or multimineral complex.
Yeah.
And in fact, that's been shown in various studies to reduce anxiety when people are randomized to get a multivitamin or placebo. The anxiety scores significantly decline in the multivitamin group, not in the placebo. That's also been shown in supplementing magnesium and B6 together or separately. So that, either one, probably in more severe, moderate to severe cases of anxiety, I would probably use a multi-mineral multivitamin, obviously really high quality, bioavailable forms of the minerals and activated forms of the B vitamins. And on top of that, I would prescribe extra magnesium and maybe extra B6.
Yeah.
There's often not very much B6 in a multi.
Yeah, we have to go quite high with B6. I think there was some paranoia. And I'm talking responsible dosing, but you can use the tens, even scores of milligrams of B6 and without ill effect.
Yeah.
Lise, you mentioned nutrients earlier. What sort of other nutrients do you use?
Yeah, so there's some really fantastically very effective nutrients that one should consider. One is omega-3 fatty acids. Omega-3 fatty acids most definitely reduce anxiety and can reduce anxiety fairly significantly. The challenge with this is that they take a while to work because they're changing the fluidity of membranes in our brain. They're altering inflammation patterns in our brain, and that doesn't happen overnight. Most people with anxiety want to get it resolved tomorrow, so you have to use other things concurrent with this. But in about 6 weeks to several months, these omega-3 fatty acids really can change brain chemistry and significantly reduce anxiety, and that's been shown in several studies, and the biomarkers of the reduced inflammation have been shown as well. So that's a must. Another really important nutrient that I use a lot in people with anxiety is phosphatidylserine.
Ah, yes.
So phosphatidylserine blunts the stress response, right? So if in response to stress, we get this big spike of adrenocorticotropin hormone in the brain. And that in the brain, I'm not even talking systemically now, but in the brain, that ACTH can trigger an anxiety. It sort of stimulates the amygdala, and it sort of processes an anxious event or an anxious state in response to whatever the stimulus was. So people who are taking phosphatidylserine have a much blunted ACTH response to a stressor. So it literally changes our brain chemistry, and it moves the brain away from a stress, anxious response. It's pretty amazing, actually. If you haven't tried it for anxiety, I would certainly recommend it, because the other nice thing about phosphatidylserine is that there have been some studies where they've looked at various doses.
Yep.
And they've looked at doses ranging from 400 milligrams all the way up to, I think, 1,200, 1,600 milligrams. And actually, in those studies, the 400 and 800 milligram dose are as effective in fact, even maybe more effective than the higher dose. So just 400 milligrams a day is a great way to really start to change that stress response. So this would be particularly useful for people who have anxiety that gets stimulated by stressors.
Yeah.
Can be really, really useful.
And do you need to stay on that 400 milligrams, or do you have like a loading dose for a little while and go off onto a lower dose as a maintenance?
I think 400 is pretty much the lowest dose that I ever use. So
right.
You could load with higher than that, like maybe 800 milligrams, and then drop down to 400.
Mm-hmm.
The last one I was going to mention is probiotics. There's lots and lots of interesting data now coming out about the microbiome, but it's very clear that when people receive a probiotic supplement, and there's been a couple of studies on this, and usually there's a lactobacillus and a bifidobacterium involved, they have less anxiety. So I think, as we know, there's a big connection between the gut and the brain, and this is one of those pathways for that connection.
That's really interesting. We know that 90 to 95% of our serotonin is actually made in our gut, but using probiotics as a therapy, I'd never sort of made that link. Wow.
I don't ever rely on it by itself, I should just add, but certainly there's so many other benefits to probiotics, it just makes sense to throw it in the mix.
Mm. You mentioned the anti-inflammatory actions of the omega-3, especially fatty acids, before, and to me it just smacks that there's an inflammatory component of anxiety like there is in depression. There seems to be more and more coming out about this now. Do you see that these people are generally inflamed in some way? What I'm talking about here is, a link to other conditions that might have an inflammatory component?
Yes, I think that there is a link between. That's why I think people, for example, with food intolerances often have anxiety, because the inflammation in their gut is through the cytokines that are getting secreted and getting into the brain, inflaming the brain. I mean, there's really very little doubt in my mind at this point that depression is really an inflammatory disorder of the brain. There's a lot of very interesting things that happen when the brain's inflamed that can lead to anxiety. There's, microglial activation, and those are like the cleanup resident immune cells that hang on to neurons and clean things up. But when they're chronically activated, they over-recruit T cells into the brain, and these T cells load up into the brain, and they're just constantly reactive, and they actually create an immune-mediated inflammation, which is destructive.
Right.
So you start to destroy neurons, neuronal connections, and the processing of the brain changes as a result.
Yeah.
We also know that the kind of the central organ of anxiety is the amygdala, so the brain's alarm system, and that is very susceptible to oxidative stress, inflammatory stress. So when that occurs in the brain, the amygdala starts to fire off a little bit too much, too often. So there's some interesting mechanisms behind it. But yeah, to answer your question, for sure, inflammation systemically will ultimately get translated into the brain.
Lastly, herbs, and there are some beautiful herbs. One of my favourites is from great work done by Dr. Jerome Saris, again down in Melbourne, and that's on the herb kava. But there are so many other herbs. Tell me what you use.
So many. So many, yeah. So kava I loved. I agree. I mean, boy. And his work is great. Clearly benefit to kava over placebo in studies, and, really used appropriately and with good quality extracts. The concerns that have been voiced around liver and all that is just really not a concern. So that's a go-to for sure. It has a nice sedative effect, so it's great dosed at night as well. So another kind of, there's so many, but okay, so go-to for me is lavender. Mm-hmm. There's been a tremendous amount of research on lavender, especially the essential oil extract of lavender. Out of Germany, there's quite a number of studies. In fact, over 400 randomized clinical trials have been done on lavender and anxiety specifically. Wow. Which is a lot of clinical trials. So in Germany, there's a preparation that's a capsule, and it's basically an extract of a lavender essential oil, which has been well studied, and other forms of lavender have also been studied. There's lavender inhalation Just getting dried lavender flowers, making a little lavender pillow and sleeping with that has been shown to be effective. Using lavender essential oil topically. There's companies that make aromatherapy inhalant, and those have been studied to be effective. So really any kind of lavender that gets those volatile oils into the body will be quite effective. And what's unique about lavender is that in these studies it's been shown to be better than placebo, which actually says a lot in anxiety studies because placebos are pretty effective. But in addition, it's better than comparable anxiolytic drugs. So like the benzodiazepine type drugs, when studied against those, it tends to be effective in a greater number of people, and the effect in those people is greater. So it's sort of better in two ways. And most of the studies on lavender show a response rate of about 75%. And that's exactly what I see in my clinical practice. I can pretty much rely on the fact that 3 out of every 4 people that I give lavender extract to are going to respond with less anxiety.
Wow.
So that makes it really reliable.
Yeah,
and
absolutely.
So kind of one of my go-to herbs. Let's see, some other favorites of mine for anxiety. Another one I like a lot is ashwagandha or Ltheanine somnifera.
Yes.
And I think this one's pretty unique because this actually increases dopamine receptors in the brain. And in doing that, it counters the anxiety-producing effects of norepinephrine in the brain. So this is particularly good, again, for somebody under chronic stress and with anxiety as a response or as a result. We know ashwagandha as an adaptogen, so it kind of works on that stress response at the same time. And it's also been studied in some clinical trials and is effective in the vast majority of people who take it, and more effective than placebo. And this can be dosed with, just a standardized extract a couple times a day, so you can get about 1 gram of the standardized extract a day, or can be dosed so that you give most of it at night because it has a bit of a sedative property. But this works great, especially for kind of that, person who's multitasking, is overwhelmed by their life, and is really anxious about all the things they can't get done. Ltheanine, perfect.
Yeah, perfect and adaptogen too to support adrenal glands. And do you find that patients are often adrenally exhausted when they're suffering anxiety, or do you find that it's more of an acute phase response?
Adrenally exhausted is kind of a difficult term for me. What I find is that most people who have chronic anxiety have hypercortisolemia. But so they've kind of flipped they've lost their circadian rhythmicity.
Yep. And
so that their cortisol is flattened at a high level.
So high, but less cycling, less diurnal variation.
Yes, exactly.
So do you find then, I'm just thinking here, do you find that there might be a link with anxiety and conditions like polycystic ovarian syndrome? There
is, in fact, a link between anxiety and PCOS, and that at least by one mechanism is clearly the result of these anxiety-produced compounds, the norepinephrine, the cortisols, finding their way into the ovaries and affecting physiology. They're increasing cyst production. Probably there's a bit of that pregnenolone, the pregnenolone being a precursor for both testosterone and cortisol. There's a bit of a steal going on, which you would think would be kind of a good thing because that would reduce testosterone, but then there's some compensatory mechanisms that kick in. So, stress, bottom line, a definite must in treating PCOS.
And what about, the use and I'd say the judicial use or the judicial choice of the ginsengs? Do you ever use like American ginseng over Korean ginseng or Siberian ginseng, or do you find these too stimulating with an anxiety disorder?
Yeah, that's a good question. I think the ginsengs are appropriate for some people with anxiety, particularly if you're trying to get at that abnormal or altered circadian rhythm. I don't tend to rely on panics. I think that is too stimulating. So I would go more towards the so-called cooling ginsengs, like the panic quinquefolius, which is the American ginseng, or even the Siberian ginseng, Eleutherococcus benticosus. I think those would be a little bit safer. But I would be a little judicious in that and be kind of start them slow and make sure I'm starting just that so that I know if somebody gets aggravated in terms of their anxiety, I can trace it back to that particular herb. Because it's a little touch and go with some folks.
Yeah. And do you find that there are some herbs that you just steer away from, or that you find are more appropriate if they have a depression component rather than just anxiety?
So I guess I would say any herb that has a lot of methylxanthines in it, I would stay away from. So certainly the caffeine-containing herbs and the forgotten the name of the one that's used as stimulant from South America.
Guarana?
Yeah, thank you. That one, those kind of things I would stay away from. And, probably, like I said, I'd be somewhat cautious with ginsengs. With rhodiola, although that's been shown to be effective in some people for anxiety, more effective than people with depression.
Yeah.
And it can be a bit, have that stimulating edge to it. Bacopa, same thing. So those would be ones I'd be a little bit cautious about. I tend to use more the herbs that have a bit of a sedative action, because the sedation from an herbal perspective is just a strong anti-anxiety response in a way. So most of the herbs that are so-called sedatives, you can dose at a lesser amount and get an anxiolytic, which is why there's so many. I mean, now we've got valerian and chamomile and lemon balm and even green tea and magnolia. I mean, there's just, you can count on all your fingers and toes. There's lots of herbs to choose from.
You mentioned green tea there, and I know that Ltheanine is a bit of a favourite of yours.
It is a favorite of mine, yes.
Tell me about its use.
Yeah, so Ltheanine as an anxiolytic is great. So just a little bit of a note. There is Ltheanine in green tea, but there's such a small amount that you would have to drink copious amounts of green tea to get enough Ltheanine. So I tend to use Ltheanine as a separate extract if I'm really going for that. But Ltheanine is really wonderful, and it's been shown to reduce anxiety, and it changes brain wave patterning so that it increases alpha waves, which are what you see when people are meditating, or there's some equipment that people can use now, alpha stim type of equipment, which also induces, sort of overlays alpha waves in the brain, and that can reduce anxiety. When the brain has a lot of alpha wave activity going on, you tend to feel calm yet alert. So you're sort of in this relaxed state of alertness. And Ltheanine will help the brain achieve more of that. And that's been demonstrated in clinical trials, actually comparable with something like alprazolam, which is known in the States as Xanax.
Yeah.
And even in adolescents, there was an interesting study that looked at boys with attention deficit or hyperactivity disorder, and they had some sleep disturbances, and they were randomized to get Ltheanine or placebo, and these boys were given 400 milligrams of Ltheanine at bedtime, and there was a significant improvement in their ability to fall asleep more quickly and then to stay asleep longer. So, and as a result, their anxiety was less.
Now, I know we're jumping back in time a little bit, but going back to herbs, I remember you telling me a story about the practical clinical use of lavender oil capsules. What happens when you take them initially?
Yes. So these lavender oil capsules have a very unique side effect. So the capsules release in the upper digestive system, and typically after people take them, they get what's called a lavender burp. And so they sort of burp up this very intense lavender smell, which I find quite pleasant when I take lavender, but some people are really bothered by that.
Yeah.
So if that happens, it helps if people take it with food. It also helps if they freeze the capsules first and they take the capsule frozen, because it kind of creates a little bit of a time release effect. And just some people just can't deal with that lavender burp and they just can't take it. But that's the minority. Most people, just get used to it, and happens once and then doesn't really happen ever again that day. So it's fine. The 80 milligram size lavender extract that's manufactured in Germany, one a day is often all that people need. And sometimes if people take the one in the morning, their anxiety is much better. And then they starts to resurface again towards the end of the day. they may need to redose it in the end of the day instead of doing some other anxiety-reducing behavior like drinking alcohol or, doing recreational drugs or something like that. So it can help in that way too.
And so I might add that, so there's research on lavender the herb, lavender the essential oil, and then there's this German phytopharmaceutical product that, what's it called? Sorry, it's by Schwaber, isn't it? Is that right?
Yes. Mm-hmm.
And what was its name? I know it's a trademark.
Lavella. Or actually, it's also known as, it has its own chemical name, which I can tell you in a second. It is WS-1265.
Right, that's the extract code, if you like.
Mm-hmm.
WS-1265. And what's it called in America?
It's either Selexin, which is kind of the trademarked ingredient name, or it's packaged as Lavella.
And just going back again to what you mentioned before about alpha waves, I find that really interesting because even music can help people to get into alpha waves. Like, for instance, Pachelbel's canon has this cycling of, I think it's 8 to 14 cycles per second or something, and that has a greater chance of moving somebody into alpha waves. Is there any other music or any other therapy like that you institute with your patients?
I don't know that I recommend a specific kind of music, but that makes a lot of sense. I recall, and I can't recall the details of it at the moment, but I know there's been some studies on drumming as a way to reduce anxiety.
Yeah. Well, that would also help with exercise as well.
Yeah, that's about all that comes to mind. Yeah.
Lise, we've gone through some nutrients, some herbs, some phytonutrients, and some herbs. Tell me, if somebody presents to you and you detect anxiety right now in them, tell me a sort of textbook program that you might institute for them.
Mm-hmm. So assuming I've assessed them, so I would, do the HAMA score to kind of get a numerical value on it for future reference and also to confirm what they're currently experiencing. I would refer them to a cognitive behavioral therapist so that they can employ those techniques.
Yep.
And in addition to working with foundational diet, exercise, sleep, hygiene, I would initiate a program of supplementation to support their mood. So I think I talked about some of the things that I would use. For example, like a protocol from me might be using magnesium. I probably would use magnesium glycinate because glycine also has anxiolytic effects. And I would probably prescribe around 300 milligrams a day, mostly at night. I would use omega-3 fatty acids for that long-term effect, probably 2 grams a day. I would think about providing some either combination product or individual herbal supplementation. I might consider things like ashwagandha, magnolia, lavender extract, curcumin as theracumin specifically to get to cross that blood-brain barrier, deal with the inflammation there. I would probably think about Ltheanine in the evening, and I would, give that a go and expect that they would notice some changes, assuming they're fully compliant. With some of those, they're fairly fast-acting, like the lavender essential extract is very quick-acting. Magnesium can be very quick. So I would probably expect them to feel some improvement, and then the placebo effect is super strong in anxiety. So they should notice some improvement within the first week. And I would probably see them back in a couple of weeks to reassess, make sure everything's going well, but really not expect the full impact of these therapies to take place for 3-4 weeks. So about a month after that, I would have them reassess their anxiety and then tweak the program accordingly. Oh, and I didn't mention multivitamin, but that would be in there too.
Yeah. Brilliant words from a brilliant practitioner. Thank you so much for taking us through that, Lise. I really respect what you do because I know that you deal with, quite complex and serious disorders on a day-to-day basis, and anxiety being a component of that in many of these cases. So I thank you for taking our listeners through those practical tips. Yes,
my pleasure. Thanks for letting me talk about it. I really, just as my final word, I would encourage practitioners again to really assess their patients for anxiety, because I think our goal is not just to get rid of disease, but is to help people reestablish a sense of exuberant living, full-on, joyful living, and they can't do that if they're anxious. So I think we owe it to our patients actually to assess for and help them resolve anxiety.
Brilliantly said, Lise. And I'll just add that there's some important links which I'll put up on our FX Medicine website for both those patients who might be experiencing anxiety and also for those practitioners treating patients with anxiety. That's at fxmedicine.com.au. This is FX Medicine, and I'm Andrew Whitfield Cook. If you've enjoyed what you've heard today on FX Medicine, please engage with us and let us know what further topics you'd like us to cover. You can get in contact with us through our website, fxmedicine.com.au, or look for FX Medicine in your favourite social media platform. You can also rate and review us on iTunes, and we'd really like to thank those who have already rated us. It's through your continued support that enables us to bring you current, complex and relevant topics to enhance your practice of natural medicine.